Oftentimes we'll have patients that come in and their main concerns are with just the appearance of their teeth. What they fail to see is that long-term vision. Something that we like them to be aware of is not only are we going to straighten the teeth and have them look nice, but functionally they're going to work better together. We're going to reduce the future wear on those teeth by aligning them, have the teeth work more as a team.
The biggest concern I have as an orthodontist is in the stability of the teeth. If the teeth don't fit together properly, then they're more likely to move as we age. In fact, everybody's teeth as we get older have the tendency to move, but the more stable a bite we can create, the more long-term that result will be for that patient.
After braces, if a patient's jaw is not aligned, there is a potential for relapse. And what do I mean? I mean that the jaw moves back to where it was before. The teeth don't stay straight, and the longevity and the health of the gums and the bone is not good. In those circumstances, we need a surgeon to go and put the jaw into the proper location.
If you're trying to move the tooth outside the jaw structure, essentially, then that tooth is going to relapse, it's going to come back. Or if you hold it out there with permanent retainers, then you're going to run into periodontal issues where the bone actually recedes.
And granted, there may be an additional expense, and some patients are concerned about that. But of course, we want to get the job done right, not only for us, but for the patient. They come to us seeking the best treatment possible, not just for their teeth, but for their facial aesthetics, whether it's their profile, whether it's their lip posture, those kind of things I can't oftentimes do by myself.
When a patient chooses not to have a surgical procedure, when indeed they should, I'm concerned because the relapse potential of their teeth going back to where they were previously is much higher. Also, the way their teeth wear down usually is greater, and so their teeth don't last nearly as long.
If you have an upper or lower jaw that's too far back that needs to be brought forward, that can lead to things such as sleep apnea. Not being able to sleep at night is a big deal, and orthodontic surgery can greatly affect that in a positive way.
Braces alone, sometimes you can't get there. No matter how hard you work, you're never going to get to that ideal result. Braces combined with jaw surgery, we're able to get the patient to that ideal situation, to that ideal result, so that they can have a more stable, long-lasting result.
Teeth are made to touch one another. They're made, the top teeth and the bottom teeth should meet, and that's proper function. If the jaw is too far back or too far forward to where the incisors don't meet with the opposing arch, we can straighten the teeth, we can hold very well with retainers, but ultimately the best natural holder is to have the jaws also aligned.
It's important in any orthodontic treatment to have a team put together. That team may involve just the staff here, but oftentimes it involves a surgeon. We work closely hand in hand together to make sure the outcomes are exactly what we want. The communication lines are open, that we know what each other need to get set up to get the best outcome for our patient.
No matter how hard I work, I'm not going to be able to get them that confident smile that they want without the help of an oral surgeon. And those patients, there's going to be a huge difference in their result if they elect to have the surgery versus if they just do it with braces alone. They're going to feel and look a lot more confident having chosen to do the oral surgery.
This can be a stable result. I want people to come back to me in 5 or 10 years and still have that same beautiful smile as the day they walked out with their braces off.
The investment is more than just the time and money put into that procedure at the time. Really, the investment becomes something far greater. It's something that's lasting, that allows them to do better in school, allows them to do better with their peers at a young age, and those wins at a young age translate into better education in the future, better social positions, better paying jobs in the future, and overall a better sense of self-worth.